pathogenesis, then we have to identify and write it down. What are the indicators in this given patient? Then only you can address that. The case 2, this is a 36-year-old female with a multiple joint pain, swelling and redness, loss of appetite, recurrent fever and thyroid enlargement. I think you might be very familiar with this RA and hypothyroidism, because most of the females who present with rheumatoid arthritis have some autoantibodies directed against the thyroid as well, and they will be taking TSH as well. So in this patient, the indicators were Vada Pitta Pradhana Dosha Dushti, Rasa Rakta Mamsa Dusha, Agni Manda, Prakriti was Pitta Kapha, Madhyama Sharira Vala. Again, the patient had RA running in her family. So that is why we implied Bija Dushti. Viruddha Ahara might have triggered that, and Roga we consider it as Vada Rakta spectrum, Samavastha. And Pajana was done with the Pajanamrita Kwada, Mrityunjaya Rasa, Sudarsana, etc. yogas. And don't think that this happened within a period of weeks. It took many months to do this proper Pajana, and followed by a proper Snehapana with the Tiktagrita and Virejana, and followed by Guduji Rasayana. So that this Guduji Rasayana, we gave the patient Guduji Sattva for 21 days. So this Guduji Rasayana brought out very remarkable results in anti-thyroid antibodies as well. And the patient's thyroid became normal. But the patient had some modern medications. I'm not saying that the patient was totally under Ayurvedic treatment. Of course, the patient had modern medicines, but the thyroxine, we were able to stop the thyroxine. That was very important. Next is another case of hypothyroidism, 42-year-old female. She was actually a nurse, an allopathic nurse. She came with the loss of appetite, weight gain, lethargy, irregular menses, and heaviness of the body. Again, the dosha was Kapha Pradhana. Then the dosha was Rasa and Medas. Then Agni was Manda. Kapha Vada predominant Prakriti, Madhyama Sharira Vala. Then the Nidana, when we assessed, the patient had all lakshanas pertaining to the Adhyashana and Abhishanti Ahara. She used to take lot of curd, dadi, and all those things, and Sandarpana Ahara Viharas. And Avastha was Sama Avastha. So we gave Deepana Bhajana with the Pippalya, Sava, Shadharana Yoga, etc. Then since she was not available for Shodhana procedures, we went with Shamana in the form of Annabedi Sindura, Induganda, Kulattadi Kwada, etc. I have not included all the medicines that I have used, but just indicators. And the patient responded, and the patient's TSH also came back to normal without any modern medicines. So obviously now it will be clear for you that thyroid is not only Kanjanara and Hamsabhadyadi. Again, I want to highlight that. Why? Because a lot of people always think thyroid is Kanjanara Ugulu. This is another case. This is another interesting case. Here the patient was a 39-year-old female. Actually, the patient came with a burning sensation of the body, sore eructations, burning epigastrium, and patient also had uncontrolled diabetes mellitus. So she had an early onset diabetes and hypothyroidism. So whenever we analyze the patient, totally the patient had Pitta Vada predominant manifestation. So this is what I am telling. Don't generalize that hypothyroidism is always Kapha Vada. We can say that most of the cases are Kapha Vada. It is not that all cases will be like that. You have to identify in the given patient. So in this patient, it was Pitta Vada predominant, Rasa Rakta Mamsa Dusha, Manda Agni, and Pitta Kapha Prakriti and Avara Sharira Bala. Again, the patient had Bija Bhaga Dushti, because familially diabetes was there. So excessive Kadu Ahara, the patient used to take lot of spicy items and irregular timings of food intake. We gave Pitta Hara, Pitta Shamana and Pajana, Tikta Pajana, Pajana Amrita, Chandragala Rasa, etc. in that line. And once we started this Pitta Jwara Chikilsa initially, the patient started improving in the terms of burning sensation, etc. etc. Then we gave Mrudu Virejana, because the patient had diabetes. We were not sure about going for Snehapana and Virejana, etc. But we went for Mrudu Virejana with Avipatti Juna, that too not once but repeatedly. And then Shamana with the Tikta Kwada, Chandra Prabha, Arogyavardhini, etc. And even at the end, we started Tikta Grida as well. And once we started Tikta Grida in the patient's sugar also started getting under control, because that irregularity in the sugar was initiated by Vada. So once we started Grida, then the sugar also started. So this is where we should not compare always modern what you call pharmacology with that of Ayurveda. If you ask a modern doctor and we give Grida in diabetes, then he will say, what rubbish you are doing. That is not in case of Ayurveda. If you think purely in the base of Ayurvedic pathophysiology, you can give Grida. I have treated diabetic patients with Dhanvantara Grida, Tikta Grida, etc., etc. And we are not afraid of raised cholesterol, etc. Only thing is that we should know in which stage you have to give. So in this patient, it was typically Vada that was causing all these problems along with the Pitta. So we gave Tikta Grida and the patient's thyroid became normal and the patient's fluctuating diabetes also came under control. So that was another case. Then this is another case. Here typically that goiter was there. The patient had that neck swelling. Again, Kapha Vada predominant pathology. Rasa Rakta Mamsa Medas as Dusha. Kapha Pitta Prakriti. Again, the patient had Bija Dushti and Viruddhahara. And also the patient had Staulya and Medo Roga. So again, Deepana was done with the Pipalya Sava Vaishwanara. And the patient was subjected for Leghana Vasti. Not one sitting, but 3 sittings of Leghana Vasti. And followed by Shamana with Varanadi, Kanjana Ruguri, Vidangadi Churna, etc. The goiter size didn't come down that much, but the patient's thyroid functions came back to normal. And then I'll conclude with the 2 cases of hyperthyroid. Usually, we Ayurvedic doctors, we are afraid of treating hyperthyroid. But there are some cases where we can manage. It is not that whenever the patient has severe presentations of Graves' disease or crisis like thyroid storm, etc., then we have to refer the patient. Otherwise, we can try and treat the patients. So here, the patient, especially hyperthyroidism, responds very nicely to Ayurvedic treatment. Only thing is that we should be well equipped to diagnose and monitor the patient. Then we can manage. So this is a 52-year-old female complained of tiredness, heat intolerance, burning sensation. The patient had a history of viral fever and the TSH was below 0.01. And we went for analyzing the patient. Then the patient had a high T4 and the patient had multiple nodules, which was benign one. And the thyroid uptake was very less. So usually this indicates that it is a subacute thyroiditis. And we assume that it happened due to that viral fever, post-viral subacute thyroiditis. In the assessment, the dosha assessment, Pitta Vada Pradhana, Rasa Rakta Dushya, Tikshna Agni, Pitta Kapha Prakriti, Madhyama Sharira Bala, and the Nidana we consider it as Jora and Upadrava Vyadhi of Jora. And even you can consider it as a concept of Leena Jora as well. So Pajanamrita Kwada, Punaravartaka Jorahara Kwada, Chandragala Rasa, etc. were given to the patient. And Shamana in the form of Guduji, Arogyavardhini, Kalyana Virda was given. So and the patient responded very nicely without any modern medicines. And sometimes in such cases, the modern doctors, they may say that the patient has resolved back without your treatment itself, because in the normal course of time, the patient will recover. But here we gave medicines and we got response. So now we are saying that the patient got it due to the medicine. Next is another case, a Graves' disease, a 34-year-old female. The patient actually was under modern treatment, anti-thyroid medicines, but we also tried our medicines along with that. So this was a female aged 34, increased appetite, heat intolerance, etc., etc. Alopecia was there, and even occasional diarrhea was there. So Pitta Vada predominant manifestation, Rasa Rakta Medas, then Agni was Tikshna, Pitta Kapha, Madhyama Sharira Bala. Nidana we were unable to elicit, so probably excessive Kadu Ruksha, etc. might have been there. We don't know. We were not able to elicit. Avastha was Nirama. So initially we went for Pitta Shamana, again Vada Pitta Shamana in form of Virakshadi, Kamaduda Rasa, etc. And we went for Snehapana with a Shadavari Adigrida. Sorry, I missed that writing there. Shadavari Adigrida was given. And Shamana in the form of Kalyana Grida, Pravala Panchamrita was given. And the patient had very good response. So these are the take-home messages that I want to tell you. Thyroid is not only Kanjana Ravugulu. Please don't consider it like that. You identify what is the predominant dosha lakshanas available in the patient. You identify what are the predominant doshyas involved at the given point of time in the patient. Then you assess the Agni, Prakriti and other factors. Then you start prescribing the medicines based on the therapeutic indicators. So predominantly we can say hypothyroid have kapha vata predominant manifestations, ama, malarupi dhatu vruddhi, and sara and ojakshaya. And in hyperthyroid, usually it is a predominant pitta vata pathology. You can see the common vata component in both of these things. Atyagni is also important, but I am not going for a one-to-one correlation of Atyagni because usually hyperthyroid can present as Jwara spectrum, lot of spectrums, Vadavyadi spectrum, Shosha spectrum. So you identify the spectrum, you extract the particular medicines or yoga from that spectrum and you can treat the patient. So Ayurvedic approach is not only Galaganda, it is considered basically as a disorder of Dhatu Agni or Bhudagni, can present as multiple disease spectrums explained in Ayurveda. And usually the assessment of Lakshanas and Nidana are important in management. So look for the dosha, dusha, agni, prakriti, bala, nidana, etc. So that ends my presentation. If at all, if there is any doubt or clarifications, if I know, I can clarify that. Otherwise, we can conclude. Thank you for your patient listening.
Thank you so much, sir. It was highly informative. And we'll have the questions and doubts usually in the chat boxes. I'll be reading it out, and I hope we can give a discussion after each question.
Okay.
Sir, can you just give a bit more information about the relation between Gramya Hara and for people who are taking Gramya Hara, you just mentioned about Rasayana treatment. No? We'll have to go to Rasayana treatment and all. So, what is the actual relationship between Gramya Hara, a person with history or a Nidana of Gramya Hara, and taking up Rasayana treatment?
No, actually, why I told is because, when you go through the reference of Gramya Hara, why Acharya has mentioned that in that chapter, that is importance, right? So why he says
yes.
is that because, at that time itself, we have to mind it, right? 2000 years back also, people used to take what you call improper diet, pishtahara, etc. Which, so Gramya Hara is not a single one, it's a group, right? So it's a collection of unwanted things that we can eat. So once you take Gramya Hara on a prolonged basis, what happens is there is improper digestion and there is accumulation of these unwanted things in the dhadus. Okay, so whenever we speak about the degree of Agni Dushti, suppose if the Agni is not functioning 90%, what happens? We will have a gross Ajirna in the Koshta level so that the patient will present with the Vishujiga, Alasaga, etc. Suppose you think a 70% functioning Agni, so that the digestion is happening but not properly. So there is a partially digested thing that is being absorbed into. Then this can get accumulated in the dhadus. So if you want to clear off those things from the dhadus, then you need proper shodhana, not only proper shodhana, repeated shodhanas, then you have to go for a particular rasayanas. That is why the concept of Gramya Hara was given in the chapter of Rasayana there. And in the terms of hypothyroidism, why I told is that because hypothyroidism is or hypothyroidism is not a disease that usually develops overnight. Usually the nidana is a prolonged exposure to a particular type of food habits or environment or the other factors. Then there is a subtle ama formation and this ama gets collected in different dhadus. Then ultimately when it reaches a threshold, it presents as a disease. Now to take out this lean or deep-seated things, we cannot have a one pill therapy like Varanadi Kashaya or Kanjana Rahul. It may need multi-pronged regime. That is why the concept of Gramya Ahara I highlighted in the concept of thyroid. Actually, this is not only important in thyroid. It is important in terms of other diseases like metabolic syndrome, A lot of other autoimmune conditions, that concept of Gramya Hara is very important. That is why you suppose you might have noticed that one rheumatoid arthritis patient came to your practice. You gave some medicines, the patient got some temporary relief, but the patient is not actually getting rid of the disease. Why? Because that is so deep seated. You need repeated shodhanas, you need repeated rasayana protocols, at least to bring some 50% relief to the patient. Why? Because that nidana was very subtle and chronic. Then that pathology also will be a slow progressive pathology. I think that is clear.
Okay, thank you so much, sir. That is clear. Thank you so much. And the other questions are, so one question is that how can we clinically diagnose the Dhatu Gada Avastha as shown in tap and water slide?
Yeah, that is what I told. Actually, that is why I gave you a lot of what you call correlations with that of symptomatology in the patient and which do. Hand over the slides, you can just go through that. So whenever certain features are present, clinical features are present in the patient, then you imply that already it is there. I'll give you an example. A patient came with hypothyroidism, that means raised TSH, and the patient is complaining to you that I have weakness, I have lethargy, I have body pain. Okay, and the duration is not that much. Then this is due to a Rasa Dhatu involvement. Because a body pain can happen due to Rasa Dhatu involvement. But you think about another patient who has changes in the bone due to this prolonged uncorrected hormone imbalance, and the patient has persistent pain, then that is a Gadavastha. So that is a difference between involvement of a Dhatu and a Gadavastha. So a chronic case where there is a chronic manifestation, then we assume that, for example, another patient came to you with infertility, then typically there is involvement of Shukra Dhatu. But once you correct it, you give one Shodhana, you give what you call Rasayana therapies and or Vajikarana therapies, and the patient responds, okay. But once the Shukra Dhatu itself is forming abnormally, so that in the forms of abnormal what you call semen parameters for a prolonged time, then you have to assume that there is a Dhatu Gadavastha, and you may have to go for a deep-seated Shodhana and other Rasayana procedures. So typical Lakshanas that indicates the Dhadus, I have already given the slide, that you can go through that later on.
So the next question is, can Avipattikara Churna be given in diabetes mellitus as it contains Siddha? Because some of the doctors won't use them in diabetes mellitus. Please clarify.
Actually, I consider it as a very big blunder, because how much Avipatti Churna we will give, isn't it?
Yes.
When you prepare 100 kgs of Avipatti Churna, it may have plenty of Siddha in that. But you take 5 grams of Avipattikara Churna, how much Siddha will be there in that? More than that, the patient will be eating rice or other things, unwanted things, right? I usually prescribe Avipatti or Avipattikara in diabetes. I don't find anything that is bad in the patient. That is not actually, if you want something that is Pittahara, you can go for that. I told you that I give Aristas, Asava Aristas to patients with diabetes. Only in a Leha Kalpana I usually don't give, because we usually give Leha Kalpana for a prolonged time. So usually Leha Kalpanas I usually don't prefer. Otherwise, all the other things you can give, I think.
Okay. Thank you so much, sir. The next question is the role of Grita in thyroid disorders. Is it only in the point of Vata Shamana, or does it have a deeper action?
No, it has so many actions. For example, we have given Indugandha Grita in a patient who has Vata Kapha predominant pathology. We have given Tikta Grita in Pitta predominant pathologies. So that depends. So Grita not only have Vata Shamana, Grita has multiple roles, isn't it? It has Samskarasya Anuvartana. So Grita action depends upon in which samskara you have done to that Grita. And also another important thing that you have to keep in mind is the mode of administration. how you give Grida is very important. For that, we can have a separate seminar, because that much elaborate that topic is.
Okay, thank you so much, sir. Sir, the next question is, how much is the recurrence of this thyroid disorders after an Ayurvedic treatment?
Definitely there will be recurrence, because these people they don't stick on to the diet or something like lifestyle that we suggest them. Definitely there will be recurrence. And another important thing that I want to tell is that please don't consider that what you call these things are fully curable. I told you already. This samprapti is a long term samprapti. So usually, if the patient may present to us when everything has already happened and the samprapti has gone into something that is irreversible, that means Yapya stage. In fact, most of the chronic thyroid problems that reaches us after all the modern therapies, we usually get in the Yapya stage. But once you get early in the stage, you can cure it, no problem. And it is also to be noted that in patients who have family history, usually a complete remission is not possible.
Okay, sir. Thank you so much. So the next question is that, sir, can you please tell us about the diagnosed hypothyroid cases where they go for a high protein diet or food for weight loss, and they will be having a tendency of chronic constipation as a result of which, and they will not be ready to stop the nidana also. So how can we deal with such cases in terms of Krura Koshta? In spite of Snehana, will there be temporary?
Yeah, actually there are a lot of studies going on depending on the role of diet in thyroid. Actually, previously, all these modern doctors or endocrinologists, they, irrespective of prescribing thyroxine, they don't suggest diet for the patients. But now they have also started suggesting diet for the patient. See, whenever you are supplementing, I'm slightly digressing from the topic. What I'm saying is that when a patient is found to have hypothyroid state and the physician writes L-troxin or thyroxine, you see, when the thyroid is normally functioning in our body, it monitors the metabolic needs, and based on that, it also regulates the secretion of the thyroid hormones. But when you are supplementing a thyroid hormone from externally, you are supplementing that in a fixed dosage, like 75 mg per day, 100 mg per day, like that. That doesn't take into consideration the alteration or change in the day-to-day necessity of the hormone. So what happens? Sometimes the patient may end up in a hyperthyroid state or a hypothyroid state. This happens because once you start supplementing the thyroid hormone from externally, you have to give a diet pattern and ask the patient to stick on to a regular diet pattern. If the patient goes on for a fluctuating diet pattern, what happens? The metabolic needs of the body or metabolic dynamics changes, and the need for the hormone changes, and ultimately the patient lands up in complication. The same is the case in this question also. Here the patient is trying for a high protein diet. Usually what we have found is that such patients, as the Dr. Drisha asked, actually these patients, they present with Vada predominant manifestations. So only way that we can go about is that they have to be asked to they have to be taught well about the pros and cons of such a diet, because ultimately they can even end up in chronic renal failure. We have seen such patients. Nowadays this keto diet and all those things are just like madness. So these people go to that and they end up in a lot of complications, end stage organ damages. So we have to ask them for doing Nidana Parivarjana. And as she told, there will be Krura Koshta, so Grida, etc. has to be given for a prolonged time. But the problem is that they may not be in a stage where we can apply Grida. So this is where the role of Rasa medicines, etc. comes into play. I think the next class, Dr. Jidesh MK will be assisting you in identifying some of the therapeutic potentials in the Rasa drugs. But I think without stopping such a diet regimen, we cannot treat such patients. And whenever we select such Snehana therapies in patients, we always have to think about Gridas that have Deepana properties like Indukanda, Shatpala, etc., etc. And sometimes we may even start with Sukumara Grida, etc. for Anuloman effect. So that depends.
Thank you so much, sir. Sir, myself, I had the patient with this hypothyroidic cases. The patient was like first she felt that she was gaining weight a lot. So what she did was that she controlled her diet because she's gaining her weight. So and that diet was also like I think she just served the net or something and took some things. In the morning, she was having this mueslis, cornflakes, or something like that. And in the afternoon, she used to have some chapatis or something, mainly something from the wheat products. And at night, she used to have like something like oats and all, or some these things. So certain things. Which is usually not that much calorie gaining. So what she did was that she reduced the carbohydrate intake. That was what she did. She made her own diet. And after 2 to 3 months, she began to experience oligomenorrhea. And it was then that she called me and she came to my clinic. I had, because of all the more features, I advised her to take the thyroid hormone function test, and even the TSH was altered. So, sir, could you just help? Could you please help me? Like, is that because of her diet that she experienced her oligomenorrhea feature, or is it because of this or maybe that she was earlier itself thyroid functioning was altered, and then she has experienced.
Maybe that earlier weight gain was due to that. See, usually what we have seen in hypothyroidism is that in some cases, initially they go for a weight loss because they will have a certain amount of anorexia initially. And due to that anorexia, they may develop weight loss initially and then later on they may start gaining weight. But in this case, I think she had weight gain initially, right? So maybe she might have had that pathology before itself. And another thing is that, see, whenever we see the dietetics part, one thing that we have to see is that irrespective of thinking all these modern dietetic principles like carbohydrate, etc., we have to think about the components that the patient takes and the action of that components on the what you call doshas. For example, we cannot say that carbohydrate is kapha kara. It's not like that. It depends upon in which form the patient takes carbohydrate is important. For example, you have yavana. If you take the composition, the yavana also has carbohydrate in that. So yavana usually induces kapha haratva and vada prakopa. But the same thing, the carbohydrate in the form of rice, that induces kapha prakopa. So what I am saying is that we should, this I tell to my students also, we should have two shelves in our brain. One shelf for modern and one shelf for Ayurveda, and there should not be any passage in between, because Ayurveda should be considered as Ayurveda and we have to interpret and use that for our practice as such. So you told carbohydrate. My question is carbohydrate in which form? I'll give you another example. This avil in Malayalam. നമ്മൾ അവൽ എന്ന് പറയാറില്ലേ, അതായത് പാർച്ച്ഡ് റൈസ്, വാട്ട് യു കോൾ that in English? I'm not getting it now. So that one patient was taking this avil continuously for some 3 months as a part of some ritual, and the patient ended up in anemia. Her HB level was below 5. So that was carbohydrate, right? But the patient ended up in Vada Pitta predominant Pandu. So how that happened? So carbohydrate she took in that form. Then that dosha what you call initiation happened. But the same thing, if she might have taken in some other form, then that might have went into another dosha predominance. So this we have to keep in mind. Whatever the diet we are suggesting, we have to keep that dosha concept in our mind rather than the modern what you call dietetic parameters.
Okay, thank you so much, sir. So there's another question. Like, sir, do you have any experience in leech therapy for goiter?
No, I don't have personal experience. I think there are some individuals who say that it is very effective in hyperthyroidism and reducing the thyroid size, but I don't know. I have not done it till now.
Okay,
Any other
thank you,
question?
sir. One more question has come up. What is the Lepana for gout? I think it's just LEP only. I think it is Lepana.
This is what, yes, LEPA. Actually, there are so many things that I have tried, like this Agu Garni, lot of things. But I didn't get any much clinical, what do you call, clinically relevant results by applying Lebana on the thyroid. Maybe there are other doctors who are practicing it and they have very good results. But personally, if you ask me, I have tried lot of things, but nothing is worth mentioning.
Okay, thank you so much, sir. I think it's almost the questions are no more questions coming up. It was a great session, there, sir. Thank you so much for sharing the information.
Thank you, sir, for your wonderful session. Thank you. Yeah. Dr. Gauri, can we conclude?
We can conclude, doctor. So it was a great session, sir. Thank you so much for being a part of our session, and we hope that you will be there for our future sessions too. It was really informative, and thank you for that detailed slides. Also, it was also really worth it. Thank you so much. Hereby, we are concluding the today's session.
Okay, good night.
Thank you.